Hello everyone, welcome to Dr. I's Learning Point. This is the part 3 of the valvular heart disease in which we will be discussing about mitral regurgitation or mitral incompetence. So, what does mitral regurgitation mean? इसका मतलब क्या होता है? When there is incomplete closure of the mitral valve, we call it mitral regurgitation. और stenosis कब होता है? When there is incomplete opening of the valves, then we say it to be stenosis. So you have to know कि what are the causes of mitral regurgitation? क्यों हो गया? So one is the valvular defect. This can be due to rheumatic heart disease or infective endocarditis. Then there can be chorditendinous defect that occurs post MI. There can be papillary muscle defect. This can occur due to acute myocardial infarction or mitral valve ring defect भी हो सकता है. ठीक है? Now let's come to the pathophysiology. तो mitral valve में problem है. What will happen? There will be regurgitation of blood into the left atrium. The left atrium में volume overload होगा. Left atrium will be stretched out. And that will cause left atrium hypertrophy. The different ectopy in the left atrium will generate its own impulses, resulting in atrial fibrillation. उससे क्या होगा? Clot formation, stroke, TIA. Now this volume overload will be transmitted to the pulmonary veins, to the pulmonary capillaries, to the pulmonary artery, leading to pulmonary arterial hypertension. उससे क्या होगा? Hemoptysis होगा, pulmonary congestion होगा. Now this will be transmitted from the pulmonary arteries to the right ventricle, to the right atrium. The right ventricular hypertrophy होगा, right ventricular dysfunction होगा, right ventricular heart failure होगा. That will be presenting as the edema. Right. Chronic stage में क्या होता है? Chronic stage में if there is difficulty in the regurgitation of blood, that means blood will accumulate and accumulate and accumulate in the left ventricle. That will lead to left ventricular dysfunction and left ventricular failure. Come into the symptoms and the signs. So symptoms क्या होगा? As there is pulmonary congestion, you will face shortness of breath, you will face orthopnea, PND. Next, as there is chances of atrial fibrillation, you can have palpitations, syncope. If the patient has right-hearted failure, then they will present as swelling, bipedal edema. और अगर pulmonary arterial hypertension होता है, then there can be hemoptysis as well. Now come to the signs of MR. जब भी signs मैं बोलती हूँ, think about the general survey. Pulse क्या होगा, BP क्या होगा, JVP क्या होगा. So pulse, what will be pulse? There will be tachycardia. Otherwise regular pulse. अगर atrial fibrillation होता है, then there can be irregular pulse. BP, there will be low BP because ultimately क्या हो रहा है, left ventricle fail कर रहा है, so low BP. JVP, if right ventricular failure is present, then JVP can be increased. अब आप सोचो, एक हो गया जनरल सर्वे के अकॉर्डिंग आप सोच सकते हो, एक हो सकता है कॉम्प्लिकेशंस के अकॉर्डिंग आप सोच सकते हो. मान लो देयर इज राइट हार्ट फेलियर, JVP will be increased, you will have edema. If there is atrial fibrillation, as I told you, irregular pulse, tachycardia. और अगर लेफ्ट वेंट्रिकुलर फेलियर होगा तो क्या हो जाएगा? कार्डियक आउटपुट कम हो जाएगा, बीपी कम हो जाएगा, एपिकल इंपल्स विल बी डाउनवर्ड एंड आउटवर्ड. नाउ कम टू द एग्जामिनेशन ऑफ द mitral area. There can be precordium bulging if there is early onset or a chronic history of heart disease. What will happen to the visible pulsations? If it is associated with right ventricular hypertrophy, then parasternal heave and epigastric pulsations can be present. What will happen to the apex beat? As I told you, whenever you are telling about a CVS examination, you have to say about the apical impulse, about the thrill, about the sounds. M, that is for murmur, and O, that is any other association or other points that you know. So what will happen to apical impulse? Apical impulse will be downward and outward. Why? Because of left ventricular hypertrophy. It will be forceful and well sustained. Sorry, it will be ill sustained. Ill sustained क्यों है? Because ये regurgitation है. अगर stenosis होता तो फिर well sustained होता. What will be thrill? Thrill will be heard in the apical area, in the mitral area, and this will be systolic thrill. और क्योंकि ये mitral area में है, that will be more prominent in the left lateral position. Okay. Now come to murmur, which is very important. In case of mitral regurgitation, you get a pan-systolic murmur. Systolic है इसलिए high pitched murmur होगा. It is a kind of blowing murmur. Now, because it is heard more in the mitral area, you get to see it prominent in the left lateral position. It will be more prominent at the height of expiration. High pitched murmur है इसीलिए more prominent with the diaphragm of the stethoscope. And very important, mitral regurgitation का murmur will go towards the axilla. Why? Because mitral regurgitation मतलब क्या? Blood left ventricle से left atria में जा रहा है. Left atria के उस तरफ क्या है? Posterior side में क्या है? Axilla ही तो है. Okay, what are the special sounds heard? Special sound में you have S3 only if there is left ventricular failure. Now you have to know the difference between S3 and S4. That when S3, S4 comes, why S3, S4 comes? So S3 comes in early diastole. Sorry. S3 comes in the early diastole. And S4 comes in the late diastole. S3 होता क्यों है? S3 होता है when there is a rapid gush of flow of blood from the left atria to the left ventricle. That means it indicates volume overload. और S4 क्यों होता है? S4 is due to concentric hypertrophy of the left ventricle. Right? So S3 is heard in case of severe MR. Correct? And S4 is heard in case of AS, atrial stenosis. तो अभी हम लोग MR पढ़ रहे हैं, mitral regurgitation, so you get to hear S3. Okay, so 3 points you have to know about S3, S4. When is S3, S4 heard? Why is S3, S4 heard? And which conditions you will see S3, S4. Okay, so now I have discussed कि MR मतलब क्या होता है, what are the causes of MR, MR क्यों होता है, what are the symptoms that the patient will say. As a doctor, what I will see as the signs and the examination of the CVS. Now I have to confirm my diagnosis, so I move to investigations. Investigation में एक blood investigation देती हूँ जिसमें complete hemogram होता है, TCDC होता है, ESR होता है और CRP होता है. I also go for urine investigations for urea creatinine and electrolytes. Most important is chest X-ray. सबको रेलिवेंट फाइंडिंग्स मिलेंगे. अगर पाल्मोनरी हाइपरटेंशन होगा तो उसका फाइंडिंग्स मिलेगा. अगर लेफ्ट एट्रिया का एनलार्जमेंट होगा देन यू विल सी द स्ट्रेटनिंग ऑफ द लेफ्ट वाटर ऑफ द हार्ट. इफ यू हैव द लेफ्ट वेंट्रिकल का एनलार्जमेंट देन यू विल सी इंक्रीज इन द कार्डियोथोरेसिक रेशियो. सो जैसा कंडीशन है उसके अकॉर्डिंग फाइंडिंग्स मिलेगा. अगेन ईसीजी में क्या होगा? लेफ्ट वेंट्रिकुलर हार्ट फेलियर होगा. तो कैसे आपको पता चलेगा? द S in the V1 plus the R in the V6 should be more than 35 millimeter. You also can do echocardiogram. Echocardiogram is the best confirmation of the diagnosis. It can also tell you about the rheumatic heart disease. It will tell you about the size of the different chambers of the heart, its motion, its volume, the condition of the valves, etc. Now treatment कैसे करना है? Treatment का दो टारगेट होता है. फर्स्ट, treat the complications and second is the intervention management when the medical treatment fails or when there is severe condition of MR. So, अगर complication है acute pulmonary edema, you will give MONT. अगर AF है, then you have to control the rate, you have to control the rhythm, and you have to give the anti-thrombolytic drugs. If the patient is having heart failure, right-sided heart failure, left-sided heart failure है, you have to see whether it is acute or chronic. अगर acute है, तो फिर you have to give digoxin, diuretics, and symptomatic relief. और अगर long-term chronic है, तो फिर add CCB and beta blockers. Now, what are the complications of MR? उसी के अकॉर्डिंग ट्रीट करना है. अभी हम कॉम्प्लिकेशंस का ही बात कर रहे थे. दैट देयर कैन बी लेफ्ट हार्ट फेलियर, देयर कैन बी राइट हार्ट फेलियर, देयर कैन बी एट्रियल फिब्रिलेशन, देयर कैन बी पल्मोनरी आर्टेरियल हाइपरटेंशन. ओके, नाउ you will answer me in the comment how to assess the severity of the MR clinically as well as investigation wise, and you will answer this in the comments below. Okay, now what are the causes of the pansystolic murmur over mitral area? This is a question that is asked in your viva. So one is obviously that you have studied MR. Now this can be a valvular MR and this can be a functional MR. Other causes can be TR and VSD. Now one more thing you have to see, that where does the propagation of the pansystolic murmur in MR takes place? So I told you that this can go to the axilla. Why it can go to the axilla? Because the blood is flowing from the left ventricle to the left atria, and left atria is located posteriorly in the body, so it goes towards the axilla. Or second, ये जो mitral area का जो pansystolic murmur है, that can also go to the aortic area. Why it can go to the aortic area? It will go to the aortic area when the regurgitation of the blood flow towards the left atria that is adjacent to the aorta. If it is adjacent to the aorta, तो वो aortic area में जाएगा. And this usually involves the posterior cusp of the mitral valve. तभी होता है. So this is all about mitral regurgitation. If you find the video useful, like, share and subscribe. Thank you.